Hello and welcome to the PYQ series of Pediatrics, lecture number 2, and quite important for aspirants of Pdcet Pediatrics exam. And you can subscribe this channel for more such videos. This video comprises few directly asked previous year questions and other quite important topics which have been asked previously, quite frequently in previous year exams of PG entrance. So now quickly starting the topics. The first question: reflexes appearing after birth. Now just read this properly: appearing after birth and not present at birth. So these three reflexes: symmetric tonic neck reflex, parachute reflex, and Landau reflex. You should remember these three reflexes. These are not present at birth, but these appear after birth. So symmetric tonic neck reflex, STNR. ATNR is asymmetric, is present at birth. So STNR not at birth, parachute and Landau. Okay. Persistence of primitive reflexes beyond typical age suggests abnormal myelination of inhibitory pathways, and this is seen in HIE cases. And important table about reflexes: appear at which age and disappears at what age. So rooting reflex appears at 34 weeks, disappears at 4 months. Moro's reflex, important one, appears at 32 weeks and disappears at 3 to 6 months. Palmer grasp appears at 28, disappears at 6 months. And asymmetric tonic neck reflex appears at 35 and disappears at 6 to 7 months. Asymmetric Moro reflex causes Erb's palsy. Questions have been asked previously. And Erb's palsy is lesion at C5, C6 level of spinal cord. Few important milestones: social smile 2 months, neck holding 3 months, bidextrous reach. See, I have compiled all gross motor, fine motor, language, social, and only the important ones. So social smile 2 months, neck holding 3 months, bidextrous reach 4 months, rolls over at 5 months, sits in tripod at 6 months, unidextrous reach at 6 months, Palmer grasp 6 months, monosyllabic words 6 months, stranger anxiety develop at 6 months, and baby sits without support at around 8. Now immature pencil grasp at 9 and mature pencil grasp at 12, bisyllables at 9 months, 2 words with meaning at 12 months. Now about cubes, many times it has been asked. So 2 cubes at 15 months, 3 at 18, 6 cubes at 2 years, and 9 cubes at 3 years. Baby knows the name and gender of himself or herself at 3 years. Identify colors by 4, storytelling by 4, buttons close fully 4 years, draws triangle, build gate with blocks at 5 years of age. So these are quite important milestones. At least you should remember these one. Another important topic: Apgar scoring system. These 5 parameters: A for activity, that is muscle tone, P for pulse, G for grimace or reflex irritability, A again for appearance or skin color, and R for respiration. So each parameter has been designated as 0 point, 1 point, or 2 point. So in total points to be calculated. So if activity or muscle tone is absent, then 0. Arms and legs are flexed, 1 point, and active movement 2 points. Pulse absent, 0. Below 100 beats per minute, so 1 point assigned for that, and for 2 points for more than 100. Grimace, reflex irritability, no irritability or no grimace or flaccid, we have to give 0 points. Some flexion of extremities 1 point, and active motion, baby will sneeze, cough, and pull away himself or herself at 2 points. Appearance, skin color blue or pale, we assign 0 points. Body pink but extremities blue, that is acrocyanosis, so 1 point, and completely pink at 2 points. For respiration, if no respiration, 0 points. Slow or irregular respiration, 1 point, and vigorous cry is present, then 2 points. So total: see, patient baby severely depressed at 0 to 3 Apgar score, moderately depressed at 4 to 6, and excellent condition when Apgar score is more than 7. So total 10 points for Apgar score. Now it is performed at 1 minute and 5 minutes. It's not used to guide resuscitation, but change of score reflects how well the baby is responding to resuscitation. So this line is important. This means that by looking at Apgar score or by calculating Apgar score, we don't decide that whether we have to resuscitate the baby or not, but the Apgar score only reflects that how our resuscitation measures are and how baby is responding to resuscitation. It also do not predict any long-term outcome. Now about upper segment and lower segment ratio. At birth it is 1.7:1, at 3 years it is 1.3:1, and at 7 years it becomes 1:1. So this is also important, have been asked in many exams previously. About head circumference, it increases at 2 cm per month for first 3 months, 1 cm per month between 3 to 6 months, and 0.5 cm per month between 6 to 12 months. chest circumference. At birth, chest circumference is 3 centimeter less than head circumference. At 1 year, both becomes equal, and after that, chest circumference is more than head circumference. Now, a few points about short stature. Height less than third percentile or more than 2 standard deviation below median height, that is less than -2 SD for age and sex, is termed as short stature. If height is less than -3 standard deviation, it is considered as pathological short stature, and between -2 to -3 SD, it is considered as physiological short stature. And most common cause of short stature is constitutional delay. Sexual maturity, sequence in girls and sequence in boys. In girls, first thalak, that is breast bud, then pubarch, pubic hair, then adrenarche, axillary hair, pre-growth velocity stage 3, and then menarche is achieved. And in boys, testicular enlargement, pubarch and adrenarche. Kleber-Betke test detects fetal RBCs in maternal circulation, that is feto-maternal hemorrhage. It is quantitative test, and dose of anti-D immunoglobulin which is to be administered to mother can be estimated by this test. So these are few important points about Kleber-Betke test. Other one is APT test. This is qualitative, Kleber-Betke is quantitative. APT is most common used in case of vaginal bleeding during pregnancy, that is antepartum hemorrhage. A positive APT test indicates the blood is of fetal origin, while a negative APT test indicates that the blood is of maternal origin. So these are important points about Kleber and Betke and APT test. Now, which of the following is not a component of KMC? Options: exclusive breastfeeding, skin to skin contact, early stimulation, and early discharge. So which of the following? Guess the answer. Answer is C, that is early stimulation is not the component of KMC. Component of KMC are exclusively breastfeeding, skin to skin contact, and early discharge of baby. Now, most common fungal infection in neonates transmitted by caregivers is Candida glabrata, Candida albicans, Candida tropicalis, or Candida parapsilosis. Choose the correct option. Guess the answer. The answer is D, that is Candida parapsilosis. Now you have to remember this one, that Candida albicans is more common fungal infection in NSU patients, but Candida parapsilosis is more common isolated from caregiver hand. So question was about caregiver's hand, so answer will be Candida parapsilosis. Now, most common childhood vasculitis is HSP. Remember the answer. Not a triad of lupus, neonatal lupus. So which of the following is not a part of triad of neonatal lupus? So answer of this is presence of ANA. So presence of ANA is not a part of neonatal lupus. So you have to remember the triad is heart block, thrombocytopenia, and rash. These are the triad of neonatal lupus. Lupus nephritis divided into various class or stages. So class 1 is minimal mesangial, class 2 is mesangial proliferative, class 3 is focal proliferative, class 4 is diffuse proliferative or wire loop lesion, and class 5 is membranous, class 6 is advanced sclerosis. So the important one is wire loop lesion. This question has been asked previously, that wire loop lesion is seen in which class or which stage of lupus nephritis. So class 4 lupus nephritis, wire loop lesion is seen. Nitroblue tetrazolium test is used in the diagnosis of, options are myeloperoxidase deficiency, chronic granulomatous disease, predominant B cell defects, and Chidiac-Higashi syndrome. That's the answer. Answer is B, that is chronic granulomatous disease. So just remember, nitroblue tetrazolium test is used for diagnosis of chronic granulomatous disease. Now, most common complication of chickenpox is stroke, meningoencephalitis, secondary bacterial infection, orchitis. Give few seconds and guess the answer. The answer is C, that is secondary bacterial infection. So it is asked most common complication. Okay, so most commonly secondary bacterial infections are seen in chickenpox. Now, gluten sensitivity enteropathy is most strongly associated with HLA-DQ2, DQ3, DR3, or DR7. Answer is A, that is HLA-DQ2. So remember this, gluten sensitivity enteropathy associated with HLA-DQ2. Stages of lung development, just go through them. Stage and age: embryonic at 4 to 5 weeks of gestational age, pseudoglandular at 5 to 16 weeks of gestational age, canalicular at 16 to 24 weeks, saccular at 24 to 40 weeks, and alveolarization late fetal stage to 8 years. So this is all gestational age. So the stages are embryonic, pseudoglandular, canalicular, saccular, and alveolar. Now, pathognomic organism causing infection in cystic fibrosis, Staph aureus, Pseudomonas aeruginosa, Haemophilus influenza, or Burkholderia species. So the answer is Burkholderia species. So if anyone asks pathognomic organism causing infection in cystic fibrosis, answer is Burkholderia species. This is also important. Now, steroids are indicated in rheumatic fever in presence of carditis, chorea, subcutaneous nodules, or all of the above. So steroids are indicated only in case of carditis. If carditis is present in case of rheumatic fever, we give steroids. Most common sequel of congenital CMV infection, most common sequel, chorioretinitis, SNHL, that is sensory neural hearing loss, congenital heart disease, or urinary tract infection. You should guess the answer before coming to the next slide, and the answer is SNHL, that is sensory neural hearing loss. So most common sequel of congenital CMV is SNHL. So these were few important topics and questions which can be asked in any of the exams from pediatrics topic. So thank you very much for your patience, and you can subscribe this channel for more such videos in coming days. Thank you very much.